All right, welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. It's Paul Thomas. It's Bill Kearney. It's Northlake Medical Pharmacy, and it's Health Talk. And Bill, how are we doing today?
Oh, it's great. This weather has just been beautiful. Fantastic. We had a Super Bowl party on Sunday, and I actually went. I took the boat out and went over to Paradise Cove and picked some people up. And it was like 70-some degrees. Wow. And then after the game was over, I took them back. And there were people over there barbecuing off their decks and everything in the little channels, and it felt like summer.
Sure.
But I hope it isn't. I hope we get a lot more rain. But this is really a good feeling, but I really want the rain to come back. And a heck of a Super Bowl game that we had.
I was going to say, how did you like the game?
I even liked the outcome, but mainly because of the quarterback and his actions. But it was a well played game and fun to watch and fun to have people participating. And
so, did you overindulge in the food and the libations?
Not in the libations. I was and not really very much in the food. When you have something that big, you have 40 people over your. You have a lot to do, and I have a driveway that is kind of downhill, and with my bad leg, it was. I was in pretty bad shape after the day was over, but
why were you parking cars?
No, just going downstairs and getting more libations, and fixing people up and waiting on people, and I have a stairway, so some people were downstairs, and but I got through it, and I'm back in physical therapy, and I'm swimming now. Swam Friday for 70 links, and then 70 again on Monday.
Wow.
So I'm still in a lot of pain. I haven't been taking any medication for the pain, and so I'm gutting my way through it because I've got to fly to Nashville to a board meeting the first of the month, and I've got to be doing okay by then. But I'll have my wife with me, so she'll watch if I fall over and try to pick me up. But lots going on, and if you're not interested in politics, or the Zika virus, or
what's that thing all about? That's
we're going to talk
scary,
a little bit about that today because it seems to be growing at a rapidly fast pace. Although it's in the communities or the states that have a lot warmer climate than we do, but it will eventually. I mean, we have cases already in California. Because people travel, this is Carnival in Rio right now, and I know people that were over there. If we're not getting pregnant, and you and I wouldn't be getting pregnant, of course.
I hope not.
We may look like we are at times, but it's a really a great risk for a female that is pregnant or maybe getting pregnant with this mosquito bite called the Zika virus. So I thought we would just go over a little bit about why you should be worried about it. It's part of the same family as yellow fever or West Nile virus. It seems like we always come up with something like this, dengue. But there's no vaccine to prevent this, and there isn't going to be for quite a while. So even though the symptoms are pretty mild, it's commanding attention because of the connection between the virus and microcephaly, which is the situation where babies are born with a small head and a brain not being very well formed. So it's a neurological order that results in them with those kind of conditions, and it causes severe development issues, and in some cases results in death. And if you've watched Paul on the news, and they show these babies over there by hundreds that are getting that.
Not to be insensitive, but didn't they have a while ago, or at least I thought I saw, isn't it also kind of known as pinhead syndrome?
I don't know that, but I think you're right.
It is, yeah. Because I've seen pictures of people that that have that same shape of a head.
Well, I've heard Bill O'Reilly ask about pinheads,
Did
but no, that's a joke.
Okay, all right.
That's a political thing.
All right.
Sorry,
I don't watch Bill O'Reilly.
You thought you were in. Well, I don't
I
either.
didn't catch it. But.
I don't either. I had it on for some reason. It was on the radio when I drove home, and it's whether you're something or a pinhead. I didn't know.
Gotcha.
Anyway, you thought you were insensitive. But then, what are the chances that we would get? Excuse me, the Zika virus. It's a mosquito that bites a person with an active infection and then spreads it by biting others, the insect, not the person. This was originally discovered in Uganda, and it's now predominantly raising concerns in Central and South America. If there are no infected mosquitoes in your area, you're likely to not contact this disease. But on February 2nd, just this past week, the CDC confirmed the first case of sexually transmitted Zika in the latest outbreak. A male partner who had recently returned from Venezuela, infected with Zika, returned to the United States and infected their sexual partner who had not traveled. So in this day and age of us traveling from continent to continent and country to country, the chances that we would be immune from any of this is highly unlikely. So the CDC had issued interim guidelines for prevention of the sexual transmission. At first, they didn't think that was available, that would be an issue. And there have been no reports of sexual transmission of the virus from infected women to their sex partners. This was from the male to the female. Until they know more, if your male sex partner has traveled to or lives in an area that's active with Zika, you should abstain from sex or use condoms. But it's 1 in 5 will develop the symptoms, and symptoms are typically mild and temporary, and there isn't any vaccine. So while the virus has been documented in breast milk and saliva and urine, it has not been confirmed that the virus can be transmitted through any bodily fluids other than blood. But I am very leery that it can be. There have been isolated cases of spread through blood transfusions or sexual contact, and that really isn't very surprising, but the virus is in the blood for about a week. And how long it would remain in the semen is something that needs to be verified, and they're working on that now. So say you get bit, and only about 1 in 5 people with the virus will actually become ill. The most common symptoms are fever or rash or joint pain or conjunctivitis, red eyes, and that can be a number of any kind of disease, and that includes muscle pain and headache. For most people, the illness is mild with symptoms and lasts from several days to a week. They don't get sick enough to require a hospital visit, so the chance that you would see them in the ER is pretty small. But more seriously, it's been linked to the birth defect and microcephaly, as well as Guillain-Barré syndrome, which is where the immune system attacks the nerves. And that's another one of the situations where some people that get the flu vaccine actually develop Guillain-Barré. So additionally, once a person has been infected, then she or he is likely to be protected from future infections. But what does that do for you? So if you think you've been exposed, you need to ask yourself some questions. Are you pregnant? And you and I can answer that fairly quickly. And this next one we can answer fairly quickly. Are you a woman who's thinking about getting pregnant? Well, I hope that's me. I don't know about you. Are you a man who's going to have unprotected sex with a woman who is pregnant or may become pregnant? And if your answer to any of those 3 questions is no, there's arguably no reason for you to get tested. Only 20% of the people who contact the virus will even develop any symptoms, and those who do will experience only mild symptoms. So there's no way 100% that you're going to know that you have it without being tested. So if you answered yes to any of those questions, you should contact your doctor about being tested for Zika. He or she can order the blood tests and find out. A blood test performed in a clinical setting is the only way to really be finally diagnosed. So the difficulty is excuse me, how can I be treated if I have it? Unfortunately, as of now, there isn't a vaccine or any specific medicine to treat the virus. They recommend getting plenty of rest, drink plenty of fluids, take medicine such as Tylenol to reduce the fever and pain. Do not take aspirin or other non-steroidal anti-inflammatory drugs. If you're taking medicine for another medical condition, talk to your healthcare provider about taking it. So a lot of people have asked, well, why don't we just get rid of the mosquitoes? What good do mosquitoes do? And very few people can see any benefit from having mosquitoes, except in the ecological environment of Florida and those kind of places where they are a source of food supply for birds and some of the bugs and other insects. But if you were to kill all the mosquitoes, would it be any better? Well, the chances are we've tried to do that in several instances back in the 70s and 80s, and they used DDT. Of course, we can't use DDT. The best hope is to limit the number of mosquitoes in an area to reduce the risk, and they're taking about actually speaking and talking of having a genetically modified mosquito that would get the bacteria and then would die. The major concern with the mosquito-borne disease in the areas where they are is on the rise, and it's probably going to be an issue that we'll need to develop a vaccine for. The future of mosquito control is not a way that we're really going to be able to eliminate it. We may be able to reduce it. It's important to remember that the mosquitoes can play a very important role in the ecosystem, and that's hard for me to believe. But just because they don't appear to be going anywhere anytime soon does not mean that we must keep ourselves from testing them and making sure that they do or do not have the virus. There's a number of ways to keep them at bay, and we've gone over this with bugs. DEET, the most basic level, you don't have pools of standing water. And that's an issue right now. Here we are. We were, 2 weeks ago it was raining, or 3 weeks ago it was raining. We've got all these little puddles around, and then it gets to be 70 to 80 degrees. And here's perfect breeding conditions for mosquitoes. So if you're outside and you see that, make sure that you dump those containers that have water. There's not much you can do about a puddle unless it's small enough that you could get the water out of it. If you're outside and insects are making a nuisance, you know enough to put on bug spray and a long sleeve shirt. It's also a good idea to keep an eye on reports of increases in the level of mosquitoes, and I think that will be fairly dominant in the future with this threat. If levels of those mosquitoes can temporarily be brought down, people should take personal precautions such as wearing repellent and wearing the right kind of clothing. So this is just the beginning. It's not the end. There's going to be all kinds of information about what to do and what we're going to do in order to curb this. This effect of having these children with small heads and a minimum development in the brain is very, very disturbing, and one that we need to pay a good lot of attention to.